Hi, Assalamualaikum. My name is Muhammad Akmal bin Rozizi. I am from RSA 2433A. Today, me and my group members, which is Syazarul Azwan, Syed, Haziq, Nurzuelaikha and Zulhairi, we will present to you about musculoskeletal condition for ankle injury. So, let's go.
Hi, my name is Muhammad Zulhairi, Fikri bin Zulkifli, and I'm going to talk about plantar fasciitis injury. Alright, this is the anatomy of the injuries. Plantar fasciitis is composed of white, longitudinally organized fibrous connective tissue which originates on the periosteum of the medial calcaneal tubercle, where it is thinner but it extends into thicker central portion, which then extend into 5 bands surrounding the flexor tendons as it passes all 5 metatarsal heads. Pain in the plantar fascia can be insertional or non-insertional and may involve the larger central band, but may also include the medial and lateral band of the plantar fascia. The plantar fascia blends with the paratendon of Achilles tendons and intrinsic foot musculature, skin and subcutaneous tissue. Let's move on to one of the common injuries at the point. Plantar fasciitis, which refer to inflammation to the plantar fascia ligament, is most commonly caused by strain injury, causing micro tears to the ligament as it attaches to the heel bone or other areas of tightness on the sole of the foot. Next, mechanism of injury. There are several factors that may lead to plantar fasciitis. They include things like tightness of calf muscle, high arch of the feet, obesity, and flat feet. Recent changes in the activities, such as running program, walking on the beach, new shoes wear, and so on, may also lead to plantar fasciitis. Alright, now for a skill test. Let's begin. To perform the test, have your patient standing on a stool or chair with the foot positioned so that the head of the metatarsal rests on the edge of the stool while the patient puts weight on the leg. Then, passively dorsiflate the big toe. The test is positive if the patient feels pain or increased pain at the insertion of the plantar fascia. At the head of the first metatarsal, if the extension is not possible at the MTP joint, this may indicate a halluc rigidus. Last but not least, the do and don'ts. The do plantar fasciitis. Firstly, rest. Your body must rest to heal. Take some time of your routine temporarily, switch running and aerobic to alternative exercises which are considered more non-weight bearing like swimming and biking as they keep weight off your feet. Remember, running usually means 2 to 3 times your body weight transferring through your feet with every stride. Next, stretching. It strengthens the muscles of ankle and foot, which will not only help in your recovery but also help to prevent the pain from recurring. Wearing a night splint while sleeping can help keep your foot stretched so the pain is diminished. In the morning, also keep a towel near your bed so you can stretch your feet in the morning before you stand up to avoid real damage. Moving on, ice and elevation, rise method. If you continue movement that places pressure on your foot, even walking, it is important to ice frequently and elevate to reduce swelling. The rise method stands for rest, ice, compression, and elevation. At the end of the day, wrap the arch of your feet with an ice pack and a compression bandage of salt. Elevate your foot and rest your foot for 20 to 30 minutes. As for the don'ts of plantar fasciitis, don't push through the pain. This can lead to increased tearing of the plantar fascia, which will lead to rupturing of the plantar fascia. Pain in the body way of letting us know to take it easy, so it's best to listen. Next, don't go barefoot. Going barefoot while dealing with plantar fasciitis is a definite no-no. Not feeling pain during the does not mean you are not causing damage. These shoes should be worn always until the pain subsides. Also, don't assume that you will never get back to exercise again. For many people, this can be the one of the most largest obstacle to healing any foot-related issue. The main reason why inflammation in our foot is so difficult to heal is because it is challenging to simplify get off our feet. That's all from me. Thank you.
Okay, hi, Assalamualaikum. My name is Muhammad Akmal, and today I will present to you about Achilles tendon injury. Okay, now we move to the anatomy of Achilles tendon injury. Achilles tendon is a tough band of fibrous tissue that have connected or attached with calf muscle to the heel bones. It also can be called as a calcaneus tendon. Achilles tendon is one of the longest and strongest tendon in human body. It can make human do a lot of activities such as walking, jumping, climbing, and running. By do all the activities, Achilles tendon react with gastrocnemius to make a movement in daily life. As you can see, the picture show the Achilles tendon is connecting with lateral gastrocnemius and medial gastrocnemius. Okay, next we move to the mechanism of Achilles tendon injury. Achilles tendon injury always happen in sport events such as football, runners, rugby, badminton, and more. Usually, traumatic injury will happen, for instance, sudden force plantar flexion or violent dorsiflexions in the plantar flexed foot. For example, in football, players who dribble the ball easily get the Achilles tendon when the opponent suddenly tackle from behind and hit the tendon. Okay, next we move to the type of Achilles tendon injury. I have provided the picture, and you can see the normal is nothing happen, but in the tendinitis, the damage can be seen. This is because the person is overuse the tendon. If you overuse the tendon and not wait to heal the tendon, it can be the tendinosis for the leg, for the tendons. And while there can be more damage for the tendons, and the tendon will be the tendon rupture, which means it's the complete tear of the tendons. Okay, next we move to the recognition of specific injuries. Okay, the symptom of injuries, you can feel pain in heel. When you touch the floor, when your heel touch the floor, you can feel so pain and uncomfortable for the leg. And the second one is feel weak and difficulty to walk. If you walk too long with that pain, you can feel uncomfortable to walk. And it also can be swelling. When the injury is become worse or become more damaged, it can be swelling and you might be can walk. You cannot walk. Okay, next the treatment of injury. The first one, we can apply RICE method. It means R stand for rest, I stand for ice, C stand for compression, and E for elevation. This method is so useful for this injury, for treatment this injury. And the second one is surgery for damaged injury. Surgery to treat an Achilles tendons is very effective, but should be considered only after other treatments fail. If you use the another treatment, but you fail to do it with their own, and you can use the last treatment such as surgery. And the last one is exercise for rehabilitation such as calf stretch, heel lift, heel drop, toe lift, and more.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Okay, my name is Syazarul Azwan bin Suzairi. So today I'm going to explain to you a little bit about syndesmotic ankle sprain. So here we go for the anatomy. Okay, as we all know, syndesmotic ankle sprain is also known as a high ankle sprain. A high ankle sprain is a sprain in the upper ligament of your ankle above the ankle itself. These ligaments are attached to the fibula and the tibia, stabilizing the entire area for activities like running and walking. So, when you damage or tear those ligaments, often due to rotating or twisting your ankle, you will experience a high ankle sprain. This type of sprain doesn't occur as often as sprain in the lower part of the ankle, such as the eversion ankle sprain and the inversion ankle sprain. Okay, as we can see, the syndesmosis or high ankle ligament connects the tibia and fibula and allows some rotation. There are three major components of the ligament complex, which is the first ligament is called the anterior inferior tibiofibular ligament or AITFL, which runs in front of the two bones. The second one is called posterior inferior tibiofibular ligament or PITFL, which runs in the back. And the third one is the interporosseous, or we call it as IO, membrane that runs down the middle of this and provide a major support between the two bones. So the next one is for the mechanism of injury for the syndesmotic ankle sprain. So a high ankle sprain occurs from a twisting or rotational injury. So they are common in sport, especially for impact sport such as rugby or American football. So an external rotation mechanism most commonly cause this tear when the foot is turned toward the outside with respect to the leg. So a high ankle sprain also can occur if the ankle is broken. So in some cases, the ligament on the inside of the ankle, which is deltoid, will be torn. In this event, the energy of the injury, which is indicated on the diagram with the blue arrow, pass from the deltoid to the high ankle ligament and up the leg through the fibula. This causes the fibula to be broken at a very high level. Okay, so for the clinical assessment for syndesmotic ankle sprains, we use Geiger test as a special test for the high ankle sprain. So let me show you how the test is done. So the first step is you hold the tibia and the fibula like this and stabilize it a little bit. Then dorsiflex the foot and lock the ankle just like I do. Last one is externally rotate it to the outside of the foot. Okay, now here are some of the medical treatment if you are having a high ankle sprain. So the first one is ice. First, your doctor may advise you to ice your ankle every few hours for about 20 minutes at a time. So the next one is compression. Wrapping your leg with a light compression bandage and elevating it in addition to icing can also help relieve pain and swelling. So the third one is anti-inflammatory and pain medication. It is advised for you for taking anti-inflammatory over-the-counter medicines like naproxen or ibuprofen that can help to reduce inflammation and pain at the site of injury. So the fourth one is rest. Of course, we need rest. You'll need to keep your weight off your injured ankle and tape or splint the injured area. Sometimes high ankle sprain can mean you need to use crutches or wear boots that allows you to walk on foot while also properly positioning the ankle and the foot for healing. So the last one is strengthen. You need to do a physical therapy because it is also needed in many cases. Therapy can make your tendon stronger to help prevent a recurrence of this type of injury. So for the last one is the recognition of syndesmotic ankle sprain. So if you want to know that if you have a high ankle sprain, you will typically feel pain that radiates up your leg from the ankle. Each step you take may be quite painful, and the pain is usually even worse if you move your foot in the same way as when the injury occurred. For example, if you sprain syndesmosis ligament by running and then quickly turning using your left foot or right foot, repeating that motion later will be very painful. So the high ankle sprain do not typically cause a great degree of swelling or bruising. This can be frustrating to athletes and coaches because a high ankle sprain generally does not look that bad. For this reason, many people can be unaware on how severely they have injured themselves and may not rest and rehabilitate as necessary for complete healing.
Hi, Assalamualaikum. Next, I will proceed with the inversion ankle sprain injury. So, firstly, I will explain about the lateral ligament ankle sprain, which is commonly occur in the inversion ankle sprain. So, I will start with the anatomy of the lateral ankle sprain injury. The lateral ligaments are involved in an inversion ankle sprain and hence most damage. Ligaments are like tough rubber bands that help to provide stability to the any joint by limiting movement. When one or more ligament is stretched beyond the normal range, a sprain will happen. These three ligaments on the outside of the ankle that make up the lateral ligaments complex, such as the anterior talofibular ligament (ATFL), which connect the front of the talus bone to the fibula or shin bone, the calcaneofibular ligament (CFL), which connect the calcaneus or heel bone to the fibula, the posterior talofibular ligament (PTFL), which connect the rail of the talus bone to the fibula. The lateral ankle ligament complex is the most frequently damaged one in the anterior talofibular ligament (ATFL). The anatomical location and the mechanism of the sprain injury mean that the calcaneofibular (CFL) and the posterior talofibular ligament (PTFL) are less likely to sustain damaging load. This complex ankle design make it relatively stable joint compared to the other joints in the body, and this stability is essential to its function. The ankle sustain 1.5 times the body weight in impact with every walking step, and up to the 8 times the body weight with each step when running or jumping. In high impact activity, the normally stable ankle is subject to increased injury risk, especially when it turns or twists too far out of its normal range of motion. Ankle injury commonly occur due to acute injury that force the ankle joint beyond its normal range of motion, such as in a sports injury or falling off a curb. Overuse injury causes by the repetitive forces such as repeated hard landing involved in the sport, such as long distance running and basketball. Next is the sign and symptom of the inversion ankle sprain. Firstly, localized pain at the site of the sprain. For the example, if the lateral ligament has been sprained, pain would be localized to the outside of the ankle. Pain is often described as a sudden and sharp and worsen with movement or placing weight on the ankle. Pain may be relieved somewhat by rest and elevation of the ankle. Secondly, swelling at the site of the sprain. In this case of the inversion ankle sprain, swelling may occur on the outside of the ankle if one or more ligaments in the lateral ligament complex are sprained. Third, bruising over the site of the sprain. In addition to swelling, patient may notice a bluish, reddish, and the purplish skin discoloration over the sprain site as an indication that ligament have torn and the blood is rushing to the area. Next, popping sound or sensation. When the injury occurs, patient may hear or feel a pop sound as the ligament is stretched or torn. Lastly, intense pain at the time of the trauma. In case of the severe sprain, when the ligaments is particularly or completely torn, the pain is sudden and severe enough to make the patient stop whatever they are doing and become immobilized. So that's all for me. Thank you.
Hi and Assalamualaikum. My name is Nurzuelaikha binti Affizan. So today I will talk more about the eversion ankle sprain. So what is the eversion ankle sprain? Eversion ankle sprain is a tear of the deltoid ligaments that happen on the insides of the ankle. It is often called a medial ankle sprain or deltoid ligament sprain. In the other words, an eversion ankle sprain occurs when the ankle rolls outwards and tear the deltoid ligament. The side of medial view, we have deltoid ligament. These ligaments provide support to prevent the ankle from turning inwards or everting. The deltoid ligament is the only ligamentous complex stabilizing the medial side of the ankle. This complex is composed of two layers, which is superficial and deep. The superficial layer includes the tibionavicular, tibial canal, and the posterior talotibial ligament. The deep layer is composed of deep posterior talotibial and deep anterior talotibial ligament. The deep layer has greater contribution to the stability of the ankle. The deltoid ligament as a whole has a dual function of providing stability to the talotibial joint as well as transferring forces between the tibia and tarsus. It might be quite similar with the inversion ankle sprain, but actually it's not because there's a little differences between inversion and eversion ankle sprain. This mechanism is uncommon but may occur in some activities, and even ground or foot abnormalities may increase the likelihood of this eversion ankle sprain. The activity that resulting in eversion ankle sprain consists of running, gymnastic, ballet dancers, soccer, basketball, and football. To perform the talar tilt test, the patient needs to sitting in the chair with the ankle foot relaxed. Secondly, the examiners need to hold the foot and then turn the ankle from side to side to abduction and adduction. Translation into adduction indicate to tear the calcaneus fibular ligaments, and translation into abduction indicate in tear in deltoid ligament. Firstly, the patient might be experiencing severe and prolonged pain over the anterior ankle at the anterior talofibular ligament, worse with weight bearing. Secondly, the point of maximal tenderness involves the anterior talofibular ligament, which is higher than the anterior talofibular ligament. Next, there is often some mild swelling in the affected area, and the patient may or may not have an ankle effusion. And lastly, the patient usually has limited range of motion in all directions.